Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And this video is to address when you get that phone call that you have an abnormal pap smear. And most likely you're being scheduled for a colposcopy. That's our topic for today. I'd like to reassure you that the experience isn't as bad as you might expect. Usually for most patients, the worst part of the whole experience is apprehension, the nervousness for the unknown. And hopefully this video is going to help you with that. Okay, so colposcopy basically means looking closer at your cervix with a colposcope, which is basically glorified binoculars. So a colposcopy is a procedure that takes about 5 or 10 minutes, like a pap smear, and it's to assess your abnormal pap smear to figure out what needs to be done. So if you get that phone call and say your pap smear is a little abnormal and you're going to need to reschedule a visit for the colposcopy, here's what it'll be like. Okay, so when you go, I encourage you to have eaten and have enough to drink so that you don't get low blood pressure or low blood sugar, because you're going to be a little bit anxious and nervous. And rarely women who haven't eaten and drank can pass out just from the anxiety. But I'm here to reassure you that it's a very simple process and that most women have minimal discomfort, if any. There are those occasions who have more discomfort, but I'm going to help you get through that, okay? So you might have what's called LGISL, low-grade squamous enteroepithelial lesion, so a low-grade lesion. You might high-grade HGISL, a high-grade abnormal pap smear. Or you might have something called ASCUS, which stands for atypical squamous cells of undetermined significance. So basically means there's some abnormal cells on the cervix they need to be looked closer at. And you also have a test for the HPV virus. There are over 100 types of the virus, 16 of which cause trouble. And generally speaking, if you're being asked to have a colposcopy, you have one of the troublemakers. But don't fret too much, because if you look at everyone when they die, over 98% of the population has this virus. It's that common. So you shouldn't feel guilty. You shouldn't feel bad. If you have one sex partner in your whole life, you have a 25% chance of the virus. 2 sex partners, 50% chance. 3 sex partners, 90% chance. Okay? So it's common. It's why we do pap smears. Okay? So when you get the procedure done, you'll get a description for you. Your physician or provider will orient you to what's going on to your particular case. And generally speaking, we do a pelvic exam and we put a vinegar solution on your cervix. That changes the abnormal cells so they show up better on the colposcope. Then we just look. We take a little sample of those cells, and that can cramp. I use a cough trick, so I have you cough when I take the sample, and it helps so that you don't feel anything or minimal. You'll find that it's a little bit uncomfortable, but nothing horrible. Afterwards, so we're looking on the outer part of your cervix and there's an opening. Then we take a sample from inside. That causes a little cramping. And if the inside is clear and then the outside is where there's a little abnormality, then depending on your age and your circumstance, your physician may opt to just observe the problem, meaning watch and see if your own body can repair it. Or they may opt to do a cryotherapy. I have a separate video for that. Or they may opt to do a leap or cone biopsy. I have a separate video for that. Or you may even need a hysterectomy or other treatments. We have some videos for that too. Okay, so overall, the vast majority of my patients, when we're done, say it wasn't as bad as I expected, and the worst part was being nervous. And I hope that this information will allay your fears and get you through this with minimal trouble. Thank you for your attention, and please leave your comments.